Okay, A4FL found the problem here was one of those hidden dialog windows. That's the reason why it wasn't working. So, getting everybody entered here. I'm trying to, still having trouble here on that logger. It's not responding. A4FL.
WA1 EXA at 911. Glad you're joining us this morning.
WA1 EXA, I'm here.
As like you said last week, that both you and your wife are getting sick, so I'm glad to hear you're able to make it today.
Well, we're kind of holding in here. We seem to be getting better. My wife finished the oral medication. I seem to have a good outcome from the monoclonal antibodies. The last test I took, though, which was last Tuesday or Wednesday, it still shows positive, but I'm getting information that basically it may continue to be positive with the at-home tests. So, but I feel okay, and we're going to test next week and see if it changed any. Back to you, WA1EXA.
Well, like I say, good deal. Glad it's working out okay for you guys. And then
Okay, A4FL. Yeah, for some reason I'm having an issue with the internal server for the QRZ. I'm not going to close the NetLogger program, but I'll have to double check and make sure my QRZ didn't expire. Sometimes that will pose a problem. What I have checked in so far is AA4FL, N9LML, N5RTF, WA1EXA, PY2BBQ, and ANDWJ8B. Are there any other stations that would like to do an early check-in if they call it AA4FL? Yeah, I see we have WW6AA with us. Good morning. QRZ seems to be working. That's a curious one as to what's going on here. Anyway, glad you're here with us. It's the top of the hour. This is the Medical Image Radio Council. Image Radio Council Digital Voice Net meeting here in the Quad Mega Array, where we're able to transcode different digital modes and speak to each other for those that might be listening. We did send out a notice about the meeting and invited people to listen on Jeff's audio server and also on Helsing's YouTube recording. So we do appreciate that. And yeah, thank you for everyone being here, and thank you for putting the YouTube streaming address up there. Do appreciate that. It's probably a different address than we sent before, so hope that one that I sent out with the notice. Hopefully we can get it when I drop one. This is the Medical Image Radio Council TV. Our digital voice net meets here in the Quadnet Array every Saturday at 1500 UTC, which of course now 11 o'clock Eastern Time. Thank you for everyone that's here. For those that are not Marco members, everyone's is able to attend and participate. No prohibition if you're not a Marco member, of course. It's amateur radio. And if you don't want to talk and you just want to monitor, that's fine too. But we appreciate knowing that you're here, even if you don't want to be involved in the conversation and the roundtable discussion that we're going to have today, focusing on Omicron subvariant BA2, and maybe a little bit on Deltacron. And we suppose that we know people have had it, they may or may not know that it was. Now we know that there's no emergency traffic. A little housekeeping. I do realize the Quadnet Array is a wonderful asset that allows us to communicate with each other using our own digital modes. You're coming in on a USB stick, coming in on radios. But with all these different servers, their computer servers, sync for the system to work correctly. So make sure after you're through with your transmission or before you start one, give it a pause. Don't tailgate. We'll let everything synchronize. We'll work better. Less likely to have dropouts. We appreciate you all being here with us. Sometimes we do have drop-ins from administrators in the Quadnet Array. And Will was here last week, W4 with WWM. He was always more than willing to offer input. We do appreciate everything the Quadnet Array does. Are there any members or guests, anyone here this morning that has limited time and would like to check in but have limited time due to obligations or travel if you're not on the repeater we are using? Go ahead and make your call to net control AA4FL. Okay, Steve, you came through here, K3FZT, but you dropped right out. So just to let you know, I never heard any audio. I just saw it come out. So in case that's a technical option, when you go to check in fully, a regular check-in, we can do that. Or if you're on limited time and you'd like to go ahead and try to get some audio in now, go ahead and do so. Steve, K3SNT, AA4.
AA4FL, AA4FL, and the group. This is K3FZT. I apologize for disrupting your check-in process by arriving late, but I hope to stick with you for most or all of the net today. Steve in Philadelphia, K3FZT, standing by.
Thanks, Steve. Great to have you here. Thanks for checking in. We look forward to talking with you today and hearing from you. Glad to have you back here on the mainland. Are there any other stations with time check-ins? Go ahead and make your call. Okay, then others heard. So far for regular check-ins, we have AA4FL, N9OML, N5RTF, WA1EXA, PY2BDQ, WJ8B, WW6AA, and K3FZT. Are there any other stations that would like to check in at this time? If so, director call to AA4FL, who is net control. Of course, I am AA4FL, sorry to present it in an unusual way. No additional calls are going into the subject for today, and we floated the discussion topic being timely, the Omicron BA2 subvariant, and then looking at the literature that was available online to the general public, and so a lot of times you're just calling it a variant. We've heard it also called the stealth variant, but genetically, I guess it's a subvariant of Omicron, and we can talk about the science of that if anybody's familiar with it. I'm not familiar with how many mutations are involved that delineate it from Omicron. I mean, you hear in the public venue the differences, substantivity, the ability to stay on surfaces, more transmissible, etc. And apparently the same screening processes that are used to tell when Omicron is present are not any different. So it just comes across as Omicron even though it's a subvariant. Let me let it drop one. In addition, in reading the literature today, or at least what's available online, I did not hit the scientific journals yet, but there was also a Deltacron mentioned, and that's something that's been asked before. Can you have Delta variants and Omicron at the same time? And there's one particular article, whether or not it's accurate or not, stated that there is a variant that has characteristics of both. And of course, as time goes on and the virus spreads through unprotected populations, the chances for additional mutations exist, and I suppose that's also true when it escapes the immunity that people have. Has everybody drop one? Has been mentioned here before on our net, Omicron has many more receptors to bind with, so you must have them all occupied with more immunity. So we need to have more antibodies generated, and thus the reasons for the boosters and such. And I'm sure it's an ongoing determination, but let's hear what your understanding of it is as a group. And we're going to rotate through now the NetLogger call list. And if you don't have NetLogger, it's the list that I read in order. Starting with Howard at 9. Oh, no, go ahead, Howard.
Hi, Ray. Thank you. Good morning to everybody on the net. I had read the same stuff online, and what I read wasn't clear on whether BA2 was the my triple hybrid of Omicron and Delta, and I listened to the doc explain that it was not a subvariant, excuse me, that it was not a variant of concern, but they're keeping their eye on it, and he was trying to differentiate it from being a new variant. So
Yeah, thank you for your input there, Howard. I'm sure every day we're going to have more and more releases as science catches up. and updated information, but it seems like everyone's getting a little ahead. But the fact that the numbers are going up in Europe, and then we tend to lag about 3 weeks behind Europe, is certainly concerning. Personally, I'm going to be going to Europe on April 26th. So I have a personal interest in knowing what's going on and trying to get a booster before I go. And I will be in Spain for a few weeks. But ultimately, the science will catch up, and the subvariant as it is described, I'm not sure either, Howard, exactly what delineates the subvariant from a variant. I am suspicious of how long it's been here in the United States. We have a number who shared on the list there, not to repeat the names, information about their infection, and they say it sort of matches the description for the subvariant, and they have long COVID and had it for about 8 weeks. So, again, everything remains to be determined. If it takes a full genetic analysis to know if you have the subvariant, I guess all you can do is go by the symptoms. But I'm not a virologist, and I'm not even a physician. So we'll go on to those that are wiser than I am. And next on the list is Jeff N5RTF.
Hey, 4FL is the net and 5RTF. Well, good morning.
I had Jeff drop here. Not sure how long he's been transcript before he pauses. He doesn't usually do a long transcript. Let's let it wait long. Yeah, for some.
I'm sorry, did you not hear me?
Yeah, Jeff, you dropped right after you said good morning. I just heard that last little snippet. Go ahead.
Okay. Well, I don't have any factual information to contribute as far as new variants. I've had a question, though. I was wondering whether working in a hospital.
Okay, Jeff, you dropped after you said words in the hospital as part of the question. I know I saw the exchange that was here, and the person that had long COVID felt that most likely patient picked up as doing clinical care, even though she was using a HEPA filter and all protected. So you want to go ahead and try to repeat the question fully, Chip? Go ahead. And if I work the FAA for us. Well,
No, I don't think this Yasu is working really well. I'll just sit and listen in 5RTF.
okay, just a question that was discussed. Was the question about the people working in the hospital being more susceptible to this since it's easier to catch and has more substantivity? Is that the question?
I was wondering whether a person would gain immunity by working in a hospital in 5RTF.
Kate did receive that question, whether or not an individual receives immunity from working in a hospital. Good question. and we can discuss that as a group. And personally, you're protecting yourself fully, so you can't gain immunity without being exposed, I suppose, for getting the disease, or certainly so clinically getting the disease. I would imagine, or getting it through vaccination. And if you're so well protected, or you're using items like they used in China, that comes to be a short-term advantage and a long-term disadvantage. Because by isolating yourself and protecting yourself, unless you're going to get vaccinated, you're not getting the immunity. And maybe in China, their immunity is high quality because the vaccine doesn't get to very well. So that's all different discussion. We'll let pharmacists take it up. Mark, WA1EXA.
WA1EXA. I'm going to give this a short burst because I don't know if I'm going out or not. So if I go off, I'll just repeat what I said. So anyway, as far as what we've seen over here, both my wife and I are still have chest congestion. We're still coughing. We still feel like we have a head cold. So does my son, who thinks he has a sinus infection, but he doesn't know for sure yet. Everything is kind of, we finished our course of therapies, and we're feeling okay. But we still have some of these symptoms, and I don't know how long it's going to last. It looks like the country's going to get hit, as you said, and we'll have to see what happens, I guess. Both Moderna and Pfizer are looking for a fourth shot for people over 65, and we'll see. I haven't heard. I didn't hear today if the government approved it or not, but I know both of them are looking for it. So that's my report right now. Other than that, everybody seems to be getting ready to open up and enjoy the spring if it ever gets here. So back to you, WA1EXA.
WA1EXA. Did you copy that question, Mark? Over.
Negative. What was the question?
Based upon your recent experiences, do you feel that your symptoms match the subvariant BA2 we're describing? Has your physician talked to you about that potentially difference, or have you compared your symptoms to the original version of Omicron? Over.
Well, my physician, I'm working with a respiratory specialist right now. Both him and the GP, my family physician that my wife's using, feel that it's too early to know if it's any different. It's got the same symptoms. What the difference is, it doesn't appear to go away. It seems like this thing's hanging on with small symptoms, and not enough to make you feel sick, enough to know that it's still around. Like I said, the at-home test anyway is still proving positive. So it's more of a curiosity, I think, at this point, because we just don't have enough experience to see if this is different or not. Back to you, WA1EXA.
I think those are wise comments, Mark. Again, unless somebody's doing a genetic analysis, they won't know for sure. And these kind of differences probably aren't enough to offer any surety. So maybe as we continue discussions, the ability for this to stay on the surfaces, even though it doesn't cause extremely severe illness, but for longer periods of time, the substantivity of it to stay on the surfaces and still be infectious, it certainly leads to be easier to catch. So, it's the importance of that to be determined over time. So you're saying that what you have seems to be a more of a live, not necessarily long COVID, but I don't know what the definition of long COVID is. Let's pass it down to Hilton, PY2.
Okay, good morning, everybody. This is PY2 BBQ Hilton from São Paulo, Brazil, and I'm glad to be with you again this Saturday. And well, what I would like to say is that the pandemic here in Brazil, and especially in São Paulo, the number of new cases is decreasing, as well as the number of in-hospital patients. So we were finally allowed to walk freely without masks, even in the inside, either inside or in the outside. We don't need to use masks anymore, finally. The only exception is medical facilities and medical offices. So even though I work as a general surgeon in my office, I still need to use masks as well as my patients. So, but the thing is getting better, and the health policy here in Brazil is thinking of progressing the disease to an endemic status. It will depend on how it behaves in the next few weeks, but probably it will be treated as an endemic disease, as many others we have here. And what else? We are starting the fourth doses of the vaccine for those 80 years old and up. And that's it. Wait one. Okay, this is PY2 BBQ returning. And that's interesting what Mark has just said about the symptoms of this variant Omicron that seems to persist for a long time. Even though the transmission of disease goes away, the upper respiratory symptoms seems to persist for a longer time. And last week, I don't remember who suggested the topic of emergency communications. Well, I need to tell you that we will have a workshop on emergency communications from IARU Region 2. It will be held on April 9 and April 10. April 9, it will be in Spanish, and April 10, it will be in English. I'll put in the group, in the email group, the directions for those who want to participate of this workshop. And the Spanish workshop on the April 9th, I will present the situation of emergency communications here in Brazil. As you must know, I'm the coordinator of the National Ham Radio Network, emergency network here in Brazil, and we had a lot of work lately because of the rains, floods, especially in Rio de Janeiro, in the city of Petrópolis. So those are the news from São Paulo, Brazil. Back to you, Jay. A4FL, PY2 BBQ.
Well, thank you, Hilton, and thanks for everything that you do at Amateur Radio, for Marco, and for the community in Brazil, for doing the national coordination. The Easter in June, I was going to cover emergency communications and emergency medical services. So, if you can send me some more details and some more information beyond just the workshop, for exactly what you set up in your participation, I'd like to make a highlight article in the June Easter. Warren has got the edition for April at the printer now. So he has to get a little bit early because his has to be printed. Mine tends to go right up to the June 1st deadline. So I will start to float requests for people to send in information, and I'll start to assemble that last teaser, which will be coming soon thereafter from the annual meeting. Let me let it drop one. So getting those articles earlier is to help the Marco annual meeting. We'll talk about in the Zoom session, at least the schedule for events in our book club that we distributed that information on the booster. But in that meeting, with the ether coming right afterwards, I need to allow room for the minutes. It takes a couple of pages. And we don't want to get too long-winded. It seems when I get longer than 12 pages in these, I've done some that are 14 and 16. People like Warren's compact, excellent job, quality over quantity. So we'll try to hit all the tone. Speaking of tone, Wilson, before I turn it back to you for more discussion, before I do, are there any other stations that would like to check in at this time? You don't have to be a Marco member if you're listening. We'd like to know you're here. You don't have to be involved in the roundtable. Still like to know you're here. Any other stations like to check in? This is the Medical MS Radio Council Digital Voice Net. Thank you, calling to myself, AA4SL. Okay, no other check-ins or so. Hilton, before we go down the list, you had mentioned the improving conditions in Brazil. Being that earlier we talked about the issue being in Europe, and it seems to lag by about 3 weeks here. During the Delta and Omicron infections, how much further behind Europe was Brazil in terms of weeks, in terms of the rise of cases? Do you happen to have any feel for that, Hilton? Over.
Yes, for FL PY2 BBQ. Yes, that's a matter of concern, and that's why the policy here did not change the status from pandemic to endemic of the coronavirus, because we see what's happening just happened in Europe and also in some places in China. This new variant combining Omicron and Delta variants, and yes, we are also about 4 to 6 weeks in delay in what happens in Europe. It seems to get first in North America and then comes to the south to Brazil. So we still need to wait and see, especially because the vaccination status is a little bit different. We have most of the population vaccinated, and that may be there may be some difference in the evaluation of this new variant with these vaccinated people, as we saw in the Omicron variant that was very effective here in Brazil, but not as virulent as other variants. So we expect to see in a few weeks from now, Jay, a 4FL PY2 BBQ.
Understood. And hopefully help in the greater vaccination numbers and the fact that you're starting a fourth dose for those that are vulnerable will be a help. Here we're not at that level yet. Plus, we have plenty of our population that have had the two initial doses. The amount of boosted individuals is less than ideal here in the United States. So, if immunity is waning and you have a situation of a new subvariant that may be problematic there, but I'm glad to hear the potential seems to be reduced. And regardless, it seems to be a less severe infection, but it'd be nice to not have it be an infection at all, but the decreased immunity certainly sets up the potential as it wanes for reinfection. And so let me go back to Chip for 1 second. So, Chip, when you're talking about natural immunity, is that do you feel that health workers in the hospitals should be concerned, or should they still get their protection through vaccinations? Over.
Well, I would say both. I have not gotten the booster because I had such a bad reaction to the second vaccination. So unless I'm forced to, I don't plan on getting any boosters in 5RTF.
Understood, Jim. Uh, question, follow-up question. Chip, do you feel that that reaction was due to the immunity of getting what essentially was a second injection, or do you think that the reaction was due to a component other than the viral response? Over.
I think that it was an autoimmune response. I had severe myalgia, arthralgia, tendons were inflamed. I had fever for 4 days. That was a very unpleasant experience.
Understood. The follow-up question to that is, if one has an autoimmune and they get a natural reinfection, will that potentially provide the same autoimmune response? So,
I guess we'll find out in 5RTF.
well, thank you for being frank, Jim. And I suppose all of us have the same, potential for reinfection, but knowing that you particularly are susceptible to an unfavorable response uh, is a reason certainly to protect yourself. We'll have to see in terms of the renewed spread here from the South variant as to whether or not people going without masks now and taking less precautions seems to make a difference. Are we going to start seeing that increase coming like it happened in Europe, which has done similar changes? Next on the list, Andy, WJ8B, go ahead.
Well, good morning, everybody on the net. Yeah, most of my sources were basically newspapers, with the exception of one newspaper article that originated from the CDC. That was out of one of the Georgia papers, let's put it that way. I can't remember it. It's abbreviated GOP, but you could tell it came from there. But from what I found, BA2 is definitely spreads more rapidly, and it may be escaping immunity to what people got from the first one. The question is it doing that because the actual escaping immunity that the disease itself or the vaccines have provided, or is it because it's so much more transmissible? The data out of the UK suggests that BA2 spreads 80% faster than the first Omicron variant. It does not appear to be any more deadly. So it's really hard or difficult to know which of the two is going on with the amount of data that we have presently. And I suspect over time, once it fully hits this country, we'll find that out. Presently, it looks like that this is data from the past week. Approximately 23% of the cases of Omicron on the East Coast, primarily New York City area, are the BA2 variant. It's also been noted in the Midwest areas around Chicago and in Southern California. So those are in the 12% range. They do expect that to spread to other areas. And the question is what do we do differently? The state that actually has the highest percentage of COVID cases presently, now this is all covered, probably the original COVID Omicron, is actually rural Kentucky. Their rates are extremely high still, and the areas there they are not recommending, lifting the mask mandate. Although I think most people are not using them, so they break their time. So that's going to be the question. We've pretty much gone back to normal activity here locally in Ohio, and most people are not wearing masks. Myself, I'm still convinced to wear them in any healthcare facility because obviously they are selecting for sick individuals when you walk into those, no matter what type of health facility it is. Obviously, ERs, urgent cares are going to be the most risky. I still do it in the grocery stores as well. It's a large number of people going to the grocery store. Yeah, the safe ones are going to be there, and of course, that you have to buy food even if you're sick. So that's all I have this morning, Jay. Back to you, WJAP.
Well, thank you, Andy. The fact that we had to review this discussion here is significant. We had let COVID drop for a while, thinking we were on the way down. So time will tell. The science will determine, but as Hilton mentioned, reaching an endemic level versus a pandemic level, that's of course a matter of time, and the characteristics suggest that this is just always going to be with us, and we'll just occasionally need to get a booster, perhaps an annual booster. Again, remains to be seen. So we'll just have to let the scientists do what scientists do, and get all the data, analyze all the data, and make the wisest suggestions, and learn to live with it. It's not necessarily disappearing. Next on our list, from early morning California, Meryl, WW6AA. Go ahead, Meryl.
AA4FL. This is WW6AA. Very good, Jay. I have nothing to add about the COVID, and it's only 8 o'clock now. And with daylight savings time, it's easier to get up. No, I have nothing that I can add except to say that in California, it looks like there's never been any pandemic. My wife and I still wear masks indoors, and my son, who's a physician at a safety net hospital, has gotten the 4th booster and still wears a mask. And Jay, I need some advice and help. I have never run a book club, so I have no idea what to do, and nor have I ever run Zoom, and so I don't know how you pick and choose and do all that stuff that Zoom does. Back to you, Jay. AA4FL, WW6AA.
Oh, Yeah, sure, Meryl. WW6AA45. I'm sorry if the email suggested that you were going to moderate. You told me you didn't want to do that. I just said that you suggested the book. I was still planning on leading the discussion, so of course we'll heavily rely on you to chirp in and offer your perspective on it. But I'm not going to let you have to worry about the technical aspects of it. I just want you to come and have fun. See yourself?
Jay, that's wonderful. You made my day. I will be there, and I'll add my I like the book. I actually it helped me. I'll add my comments after your discussion. Thank you very, very much, Jay. Go ahead.
Thank you. No, and by the way, when I sent that out and I sent the link to Amazon for purchasing, they had the hardcover, they had the Kindle edition, and they had the Audible. I happen to have some Audible credits, so I put into the Audible version, but there wasn't a paperback version available for some reason on Amazon. So I hope individuals won't find that to be an issue. Hopefully we'll get participation. I don't want to take this personally if it also registers that collective yawn I talked about before. But I named a coffee house at 9 o'clock at night on the East Coast. It'd be a decaf coffee house, and we're looking forward to that being the first book. The second book, I have not set up a name for yet, but that one's been suggested by another member. Thank you for the suggestion, and thank you for being willing to be present with the book club. K3FCT, Steve. Good morning to you. Go ahead.
AA4FL in the group. This is K3FZT. Well, hello everyone, and nice to hear this Saturday morning conversation after 7 weeks, 5 time zones to the west. Much as I enjoy the group, I was not getting up at 0500 to enjoy the group. As far as COVID and the Omicron BA2 variant, I have several thoughts, not necessarily based on any science. My first thought is that I am delighted to learn that the Centers for Disease Control, with the participation of local water and sewer systems and county health departments, is in fact tracking COVID virus in sewage effluent for something like 60 some locales across the country, and has been seeing for several weeks now described as an uptick in the radio reporting I heard of the variant of interest. I applaud that kind of tracking. I did not have as bad a reaction as Chip had to the second vaccine dose, but I did have a reaction. Interestingly, when I got my booster, I had much less of an acute reaction but I very definitely had a myofascial syndrome of some sort for some weeks. I know that because I lift weights. Let me reset. I know that. I know that because for some weeks I was not able to lift the same weight or accomplish the same number of repetitions that I had just before the third so-called booster dose of Moderna. So I am being cautious about a fourth dose because I do believe that immunological memory, T cells, and other components of the immune system remain active even as antibody levels fall. I and my wife are masking. Frankly, we have little concern about the supermarket because our exposure there is for short periods of time. There is a large volume of air and generally good ventilation. I think the Japanese approach of being particularly cautious around closed spaces with poor ventilation and crowding, such as in bars and concert halls, has some wisdom. And while many of my friends have, in the music community, have gone back to both concertizing and attending, Simone and I are hanging back from that activity unless it's outdoors. So that's what I've got, and let me turn it back to you, Jay. Thanks so much for running the net. I do want to report that many of you, not on every transmission, but on quite a few of the transmissions, there was packet loss in the range of 5 to 15%. That, coupled with perhaps being a little close to the mic, made intelligibility difficult. Back to you, Jay, KZFZ.
K3FZT. Well, thank you for the information, description, and also for the technical information as well. Good to have you here, participating with us, Steve. That's always much appreciated and right on target. And hopefully I'll get to do an eyeball QSO in the future. Of course, I don't know if you're going to Xenia to Ham's mention, but I happen to be coming up to Philadelphia for a wedding in October. I'll probably be driving up there, going through the general area as well as a good part of Pennsylvania, so hopefully we can get together at that time. And also a few of our other members I was hoping to catch up with. I see we have Jerry in for TSC now here. Vince and Jerry. We were talking, of course, about the subject material for our discussion. I'm usually longer, I suppose. Would you like to offer any input here, Jerry? And for TSC, go ahead.
Okay, it's on the group and for TSC. I actually had the monitor on from about 1500, and I just heard you come on maybe 10 minutes ago, and I tried to
um, see what's going on NetLogger, and it took me a while to get NetLogger up and running.
Okay, well, I'm glad you're here now. Do you have any information about Omicron you'd like to impart to the group there, Jerry, on 4TSC? Go ahead.
Zoom connection based on the book that was recommended. I don't know whether I have access to that book right now, but anyway, I'll listen and learn. Back to you, AA4FL and 4TSA.
Okay, Jerry, I'm not sure if you dropped. I thought you were finished with your last transmission. But if you're monitoring, we'll give you a chance to come back and discuss in just a moment. And are there any follow-ups discussion here after we through the list the first time? If you have some additional comments you'd like to make, please go ahead and call me. I'll make a list for those that want to ask questions or make follow-up comments. Go ahead.
AA4FL and 5RTS.
Okay, Chip. Let me just see if Jerry's back with us before we come to the follow-up. And for TSC, did you want to continue with your previous transmission? Jerry, go ahead.
Yeah. The problem is, but I don't know when I dropped that. Just basically, I wanted to say I'm going to listen and learn and find out what's happening. And I'm not on NetLogger, only that I was able to finally get it for TSC.
Okay, Jerry, you're kind of popping in and out here. We got little bits of that. Out of curiosity, I think it was Steve that was looking at packet loss. K3LCT, what did you see on Jerry's signal?
AA4FL and the group, I'm seeing 0% packet loss, but that's only the last transmission. It's not across these various breaks. I'm given how it's there have been so many interruptions to so many different people. I'm wondering whether it's individual operator issues, either hardware or operational parameters, perhaps internet connectivity, or if there's more central phenomena going on. I was looking to move to an XLX reflector at one point with the QuadNet array, and couldn't find any of them. So that's unusual. K3F said
Well, thank you, Steve. K3LCT. If Will or one of the other administrators is here, perhaps we'll bring the lecture to a close in a few minutes. You can comment to Steve about the issue of finding those additional reflectors and whether or not they exist or have the potential to be set up for more efficiency. So on to our second go around here. Chip N5 RTS. Go ahead.
Yeah, thank you, Jay. my biggest concern about myositis, even though it's uncomfortable, the real problem is that the heart is a muscle. So anything that's going on peripherally, you worry that it's also going on in the muscle and tendons of your heart, which could certainly be fatal in 5-RTF.
Yes, I understand what you're saying. One of my friends who had some grafts, and immediately after his second dose, uh, ran into some cardiac problems with inflammation, and it went on for about 6 weeks before they were able to get his heart to be fairly symptom free. I can't remember exactly what they hit him with, uh, but uh, they had to work hard to get him some relief. Any follow-up comments on that, Chip? Go ahead.
No, just that's my biggest concern about taking another vaccine. I think I would resist that as strongly as I possibly can in 5-RTF.
N5-RTF AA4FL. I totally understood. It's important for one to know their experience and to base their personal decisions based upon the risk that they feel they're going to experience. Absolutely understandable. And for my friend who was a dentist and works with patients, closely decided not to take additional doses. I don't think the physicians were allowed to because he had such a bad reaction involving the heart. Any other follow-up discussion here before we bring the net to a close? This is AA4FL, the Medical Image Radio Council, DVNet. Go ahead.
Excuse me, and I don't know, sir.
N9OML, AA4FL, go ahead. Sorry.
Jay, just a comment. The Open Quad, or excuse me, Quad Array people at openquad.net, openquad.net, updated their webpage to reflect the new module designations and some new reflector options for getting in. So the updated information should appear on the openquad.net landing page.
Well, thank you, and we'll let those of you explore the revisions on the coordinate array page as to how to log in. And perhaps the next time we list that, we can at least do a short blurb directing people to that in the ether. Thank you for participating today, Howard, and for making that recommendation. Any other discussion before we bring that to a close? Go ahead and let me know if you need to make a presentation. AA4FL.
UA with EXA?
AA1EXA, AA4FL, go ahead.
I just have a general question, and someone can call me after that. You don't have to hold everybody. Has there been any information out there about restrictions in talking to any of the Russian hams, or on the other side of the coin, is there anything going on with trying to communicate to Ukrainian hams? I just was curious if I haven't seen anything. So, if someone knows something, if you can tell me, I appreciate it. WA when the XA.
Well, I'm going to bring the next to a close, and I'm going to let you all pick up that discussion. I did notice, as many of you probably did, if you were checking out media today, that surprisingly, the cosmonauts arriving at the space station were wearing Ukrainian colors. That's a significant, I significant departure, as you would expect. And I'm sure that's going to cause a lot of strife in Russia. So let's see what happens there. But that's a good discussion for that I can open up for anyone here in the club right after the net comes to a close. Any other comments before we close the net? Go ahead. Ms. A. Forrest. There's no other business for the net. This is Alpha Alpha 4 Foxtrot Lima for the Medical Image Radio Council TV net. We look forward to speaking with everyone again next week at 1500 UTC on Saturday. Or perhaps we'll have some more follow-up. 1 week is a whole other world here in terms when developments are occurring due to COVID and the new strain in particular moving quickly. We may see a move towards the United States, towards North America. We'll pick that up for next week. Say 7-3 to everyone. Enjoy basketball as they use it